Without vaccines, there'd be no Freedom Day at all. But they're not the only factor dictating how dangerous or not the growing wave of COVID is going to be. A rapid return to normal behaviour now could push cases far beyond levels we've seen before. But the closing of schools for summer this week might do a lot to dampen the coming surge. Each is highly unpredictable, and while the government insists it's not a gamble, their leading science advisor knows it is.
This is a calculated risk. In reality, what we're going to have to do is wait probably for about 3 or 4 weeks for the impact of today to be felt on case numbers, truly. And then we'll be in a better position to say really, what size is this third wave going to be.
Case numbers are already close to the peak we saw in January, with numbers doubling every 2 weeks or so. Computer models predict we'll hit 100,000 cases by early August. What's much less certain is whether that's the peak or cases continue to rise to an unimaginable 200,000 later in the month.
Worst case could go up to 200, maybe even 250,000 cases a day. That's perhaps less critical, though, than what the hospital demand is. We are going to hit 1,000 admissions a day regardless of what happens. Now, the real question is, do we hit 2,000, which would be half the peak reached in the second wave, or in the worst case, 4,000, which would be very comparable with what we were seeing in the second wave.
Because of vaccines, even those worst case numbers translate into mortality figures just a fraction of the January peak. But NHS doctors are still very concerned about capacity in the system.
Any added stress from viral infections causing hospitalisations and intensive care admissions, plus the emergencies, plus the efforts to catch up on the elective waiting lists, which are more than 5 million people, means we've got a really serious triple threat this coming winter.
Officials this evening making the same appeal for common sense and restraint.
If we are gradual and cautious and we don't tear the pants out of this just because we're glad to have our full freedoms back, then we will materially affect the size and shape of the remainder of this epidemic curve.
If everyone does their bit and hospital admissions and deaths remain low, there's a good chance the government will win this public health gamble. But the odds are very uncertain and the risks very real. Tom Clark, News at 10.